Hi, everyone. This is Lynn Crawford with Hope Dementia Support, and I'm here with our home care and placement panel. And I'm going to allow each of them to introduce themselves and tell you a little bit about them and their organization. And I'm going to start with Christina Hanksler from First Choice Advisory Services.
Hello, I'm Christina from First Choice Advisory Services. Thank you so much, Lynn. Is that all I'm supposed to do for now?
No, you can
Do the
actually go
rest?
ahead
Okay.
and
Okay. First Choice Advisory Services has been in business for over 33 years. Our owner started the company up in Mill Creek, Washington, because he saw a need for families that were trying to find the right fit for their families and were struggling. And so he decided that he would be part of that solution. And he took a pad of paper and a pen and started making phone calls and asking people for help so that he could help make those matches. So over the years, we have grown and we have offices in Seattle, Spokane, Tacoma, Olympia, Vancouver, and we have two teams in Portland helping people. Our advisors live in the communities that they serve and know all the players. And I think that really makes it helpful for us to be efficient and helpful for families to help them to get to where they need to go. Our services are no charge to families because we have relationships with all of the options in Vancouver and all the other areas. We really do endeavor to know all the options. We may not use or refer to all those options because they may not meet our standard of care, but we do want to know who are the players and what's going on out there. I am grateful to be in this role, to be able to help families and to support them, whether it's a phone call for help deciding what in-home care option might be a good match for them, or it's a crisis situation and it's not safe for mom to go back home and we don't know what to do. And I'm just holding space for them and helping them walk towards what they need based on what their needs are. Financially is a big piece that we talk about. So I'm wanting to be efficient and help them get to where they need to go. Socially, medically, all the things that make up a person, we're listening really carefully so that we can be be mindful about helping families. The team in Vancouver is Rachel Lovinger. She is the other advisor that works with us. And then Nathan Pace, who is our marketer, and his job is to go out and tell people that we are here to help families. And then we are here to help families when they call. And I think that is all for the
All
moment.
right. Thank you, Christina. The next is Ginger Barnwell, who is with CDM Caregiving Services.
Hi, I'm Ginger. I work for CDM Caregiving Services. I've been there for 7 years. We are we are the oldest home care agency in Vancouver. We've been in business since 1979. It was started by three community members. That's where CDM comes into play at C, which is Calhoun, Deckard, which is for the D, and M is for Murray. We are a nonprofit organization. We have different state fundings. Most of our clients are on a Medicaid program, but we also accept VA, DDA, and also private pay. Um, so CDM is one portion of our business. So we do in-home care. We have about 500 clients right now and about 200 caregivers, give or take, during COVID, which happened to a lot of agencies. The ratio went down quite a bit for caregiving, but we're building up on that right now. Lots of new hires, which is really helpful for our clients. Um, we also, besides our home care, we have our adult day center and adult day health. This is a wonderful opportunity for loved ones that take care of their people in their home to have respite. We are open from 10 to 3 in our adult day center. We do activities, music. We serve a healthy lunch. It's a great time for loved ones to, that are, have experienced a little bit of caregiver burnout to be able to have that respite care during the day. So someone can go out and, do their errands or just have a break, go out to coffee with their people, which is really important. Um, we also have a grant that we have with ADSWA, Area Agency on Aging, um, it's called an Are You OK program. And that really constitutes that we have people in the area that are alone in their home, mostly elderly, that really could benefit, maybe don't need home care, but could benefit from just a friendly phone call. And we provide that service. And that's just a simple referral. Really, not a lot of information is needed for that. And we set up whatever call schedule you want. So we do have that program in place right now, which is lovely. We're building upon that. We serve for that Clark County, Skamania County, and Klickitat County. And it's really beneficial. If anyone interested in knowing more about that, please reach out to me. Any questions yet?
Well, I wonder, Ginger, if you'd like to mention your other program.
The Living with Dignity program or
Well,
Hope?
or Hope Dementia Support.
Your Hope. So yeah, I wasn't sure if you all wanted to. So Hope is also, how do you call that? Is it that we're partners right now, right?
Yeah,
Um,
that sounds good.
Yeah, we're partners. We all share the same building now, which is lovely. Today, Julie is a great resource, so I was able to tap into her knowledge of dementia. And we work as a team, and couldn't say enough great things about Hope Dementia.
Thank you.
Yeah.
So next we have Jessica Barilla, who is with the Pacific Northwest Aging Specialty Services. So Jessica, if you could tell us a little bit about what you do.
I would love to. So I am Jessica Barella. I'm the supervisor of direct care over at PNW Aging. I've been with PNW Aging going on 4 years, but we were formerly Elfin Services. So I've actually been with this company for going on 12 years. One of the really unique things about us is we are a private in-home care agency that's local. So we're able to do really customized care plans, make local decision making, do local decision making. So all of our team can do things on the spot. So we can go out and meet with clients, do customized care plans, whether that's going to be in the hospital, their own private home, an assisted living facility, wherever that's home. Another service that we offer at PNW Aging is our care management team. So our care managers can go out and also do the same thing, make a personalized, tailored care plan to them, looking ahead in the future. What are their health goals? What are their care goals? What are they looking for to happen? And we also provide healthcare power of attorney services and relocation services. So there's going to be times that people are moving from one state to another. Our case management team or our in-home care team at times have traveled outside of Washington state as far as like Texas to relocate people. So, you know, a lot like the other agencies here in town, we are just local. We do accept long-term care insurances, but we primarily are private pay. So we can do everything from 1 4-hour shift a week up to 24-hour support.
Thank you, Jessica.
Mhm.
Next, we have Sarah Sheets, who is with the Senior Living Locator. And can you tell us a little bit about what you do, Sarah?
Yes. So I'm Sarah Sheets. I'm the owner of Senior Living Locator, local agency right here. I only serve Clark and Cowlitz County and refer out if it's beyond that. So sometimes, over in Portland or up north, but I just stick to our local network right here. I've been in long-term care for 20 years now, which is pretty much my whole adult life. And I do have my adult family home administration certification. So when I'm helping families look for placement, I really understand the depths of what the various communities, adult family homes, assisted living, memory care, what they can do, what the regulations are, which can help guide you in looking for what your specific care situation is, whether that be current or also what might be coming down the road. As referral agents, nobody has that crystal ball, but we, based on our experience, like to try to look forward as much as possible so that you're making an informed decision, both for what fits your needs now and what can hopefully fit your needs or your loved ones' needs in the future. I tour with my families, so I am with you every step of the way. And one of the things that I pride myself on is having the conversations early. And I think we'll probably get into that a lot more tonight when, as the topic of the conversation is, how do I know when it's time? And I will tell you, it's never too early to have the conversation. So start out with a conversation that helps, so much. And then the next step might be going to look, but decisions don't need to be made, right away. That all comes down the road. So, um, yeah, I think that's probably about it. And
Okay.
look forward to having this conversation with everybody.
Thank you, Sarah. Last but not least, Julie Williams with Home Instead. And Julie, you were the last person on my screen, so no offense here.
That's okay. That's all right. Hello, everybody. Thanks for being here. Really appreciate it. I am the owner of Home Instead, and I'm coming up on my 20-year anniversary in August, which is really exciting. I can't believe it. 21 years ago, I was learning about Home Instead and watching a caregiver ceremony where they were honoring a caregiver of the year. And there wasn't a dry eye in the house because that caregiver had so much impact on this particular client they were talking about. And I looked at this and I said, I want to do that. That looks amazing. And 21 years ago, I said, let's do it. And here we are 20 years later, and I love it still. Um, we do in-home care. People often ask, how do you get started? How does that look? Well, first, we'll meet you in your home, and the conversation can be just a conversation. It doesn't have to be, you have to sign up. It can be just asking questions and learning about uh, what it might look like. And we can do 4 hours a day, up to 24 hours a day. Oftentimes people wonder if their parents need help, and what signs are you looking for? Um, I think each person can be different and unique in what the signs are, but often things like maybe the bills aren't getting paid, or um, the the house isn't kept up as much, or they've missed a couple of doctor's appointments. Those kinds of things can kind of give you some inkling as to maybe there's something going on. Um, but again, conversations, starting them early, and know that it's not going to happen the first conversation you have. It might take a few conversations and maybe a scare of a fall or a near fall that will maybe motivate them to be more interested. We take private pay. We have a contract with the VA as well as long term care. And we do have a grant program called Hilarity for Charity. And you can apply for grant money and get up to 100 hours of care through that, which is also a nice benefit as well. There are programs that Home Instead gets involved in to be involved in the community and stay in touch with folks that are serving seniors. So every year we are involved with Be a Santa to a Senior. We get involved with any of the nonprofits that are here in Clark County and support them as well, that if they're serving seniors, like Hope Dementia Support, CDM Caregiving Services, and the Caring Closet as well, which is a great resource in our community. So that's a little bit about me and Home Instead. We can move on to the program.
Thank you very much. So everyone that is has joined us today, this is wide open for you to be able to ask questions of our panelists. And you can either put your questions in the chat or you can actually raise your hand and we'll let you ask your questions. But before we do that, and while people are thinking about their questions, I really would like to focus just a little bit on those things that make people think that it might be possible that they could use a little bit of help in the home, a little bit of respite, a little bit of support. So those of you that do that, Julie, Ginger, what are the kind of things that you see that are telltale signs that maybe somebody needs some help in the home? And you touched on that a little bit, Julie.
Well, yeah, I touched on it a little bit. Like I said, maybe they've always had a clean house and it's not clean anymore. Maybe their refrigerator is got a lot of outdated items and nothing nutritious in it. Um, Maybe they talked about a fall or a close call of a fall. Um, Maybe you're seeing some signs of forgetfulness, um, which could be a precursor to dementia. Those are the kind of things that you might notice.
And can you speak to the need of the caregiver a little bit? I'm thinking of a
The,
particular caregiver that I just talked to today that I think is right on the edge.
oh, sure. Um, Oftentimes, when I meet with the family members and we're talking about caring for someone with dementia, the caregiver is doesn't probably even recognize how close to depression and anxiety if they aren't already in it. And I can ask a couple of questions and barely scratch the surface, and tears start to flow. And to me, that tells me you are in need of help. You are at your wits' end. You are struggling. And that's the time when you really need to reach out. Probably was earlier, but if you notice it now, it's time to reach out and get some respite, whether it's the daycare, bringing adult daycare, or getting some home care, or even just going to a dementia support group too.
Ginger, what jumps out at you?
One of the things we have noticed a lot of is recognizing when Julie pointed out all the things that you're recognizing. One of the things we've noticed a lot is when someone stops taking care of their personal care. Um, you know, obvious, we'll go into a home and already taking care of someone and doing very, light housework or their errands, but notice a progression of, oh, they stopped showering, their hair hasn't been washed, or it doesn't look like they've changed their clothes. All of those things, that progression of what happens sometimes when you're aging or, have dementia or dementia symptoms. That's one thing I've noticed a lot with the clients that have been serving.
Okay, thank you. Thank you. So and then the I'm thinking about something that Sarah had mentioned about the fact that it's fine to go look without making a commitment. We call that the backup plan. And I wonder if you could speak to the backup plan a little bit in terms of, yeah.
Oh, yeah, absolutely. I know, yeah, Hope refers to it as the backup plan. I say always having plan A, B, and C. Um, and, sometimes life just throws things at us and you might have a hybrid of all three plans. But typically when someone calls, I'm asked, the first question I have is what resources they have on board. Sometimes they're calling because they're a referral from Hope. So they have the dementia support group, and that's phenomenal. But are they having anyone come in to relieve them of their caregiving duties, whether that be family members, friends, or an agency with caregivers? And so, often that's the suggestion for the first step. It's really rare unless something is pretty extreme that if someone's just kind of calling and asking when is the right time, that and I think Christina, operates pretty similar to we don't jump into, well, now's the right time just because you're calling us. Um, and so, what can we do in the meantime to give you relief right now? Even if it is an urgent situation, there are still things we can do to help you in the meantime. And so, making sure that the caregiver is supported, and then making sure that the person that you're calling about is safe are two equally important parts on our end that we do. So, Plan A would be getting those resources if you're not ready to move or move your loved one in, is getting those resources. Hope, support groups or caregivers on board. And then Plan B would be where would you want to move? If you had to move today or you had to move your loved one, where would you want that to be? And whether that's doable or not, is going to depend on the situation. Um, there's been a lot of times where people are like, well, I would really want to go live in a community. I like the idea of all the socialization. Um, I want to be able to, go have restaurant style dining. But then if you wait too long, sometimes what we see if falls happen, you have to have, hip replacement surgeries, things like that. Sometimes those places are no longer options. So having that open conversation about that, waiting, you might be safe, and fine at home now. But if you're worried about those things happening, sometimes it's better to move sooner, into those places so that those are options, whereas later they might not be. So it's really having in-depth conversations about that, and coming up with, the backup plan or the backup plan of the backup plan, too. Christine, I don't know if you want to add to that.
Yeah, thanks, Sarah. Um, One of the things I was thinking as you were talking about all of this is that working with Sarah or with me or Rachel, you're never going to feel pressured. So you can call and not worry about it's sales that's going to happen, that we're going to shove you forward. Sarah and I do a great job of holding space for families and giving them information. I just had a consultation today with a gal and just said, hey, here's, we talked through the things. She was really grateful just to have talked to somebody that understands and that can be empathetic about what's going on. And also, informational. Here's what I know. Here's what I'm thinking about what you just shared with me and some of the options. Like Sarah was talking about, maybe your husband is not appropriate for an adult family home because you just told me he likes to leave the house and go run down the street, and you're worried that he might not come back. So then we're talking through the options that exist, but it is always in a very collaborative and supportive way. And what do you think makes sense for the next step? And then we're following up if that's appropriate or letting families reach out to us when they're ready. So I think that's important for people on this call to hear that this is not a pressure sales. And it's not that like that at all for in-home care either. Everybody is here to do the right thing and to support seniors and their care partners to get the help they need.
So I have a very specific question. It says, how do you find facilities that are truly safe for people who have celiac disease?
I've actually had celiac specifically, in the past, and really, I find adult family homes a better environment for that because it's a more controlled environment. It's not, they're not feeding, 30 to 100 people. They have six. They can usually prep the food in a different space. So, that would be my suggestion if someone called and said that they have celiac and it's really important. My suggestion would be an adult family home in that case, or in-home care, if that's an option for in-home care to come in, because they really would be able to manage that, in your own home.
I agree.
So, and comments from the folks that do in-home care? Is that
Yeah,
something that you?
I was thinking about that when she was talking. I think it's, the really nice thing with in-home care is, we really can match the caregivers to the client. So if they have celiac, we can take a look at that. We can customize that into their care plan. And then we can make sure that the person that we have going out there understands it. We can educate them. What are the risks involved with this client? Like what are the things that you need to do as a caregiver to really make sure that their needs are being met? And by making sure that we're matching them appropriately, that's how we can do that.
Excellent. So this is a question for all of you. Understanding the current landscape, what are the biggest challenges that families are facing before they ever contact any of you?
I would say knowledge, not understanding the system when they're calling us, not understanding the difference between home health, home care, uh, home repair. No, but yeah, so understanding how the system works, what's covered by Medicare, what's covered by Medicaid, what's not covered by anybody, um, and the difference between an independent, assisted living, memory care. All of that is something we learn as we go through our, and the longer you're in this business, the more you, of course, learn and pick up. Um, so yeah, I think that understanding what your options are and what the costs are and yeah, would be wonderful for them to have that knowledge before calling.
It's really complex, isn't it?
Yeah, it is.
Mm-hmm.
Other things that you guys have noticed in the last year or so?
I would say the financial burden. And I think it probably, I'm guessing with in-home care too, as the care needs, increase. And so they might need more hours in order to stay home, which then gets more expensive. And then, um, but then also, the cost of care to live in a community, whether it be, a small community or a large community, the cost has continued to rise over the years. And so, and I see that especially with spouses, being able to plan so to be able to pay for the care for the person that needs it, but then also to be able to have enough money left over so that down the road, if you also need care, that those funds are available to you as well.
Other comments? Because I have lots of questions. So I have someone asking, for someone who already needs home care at home part-time, what are some signs that they are no longer safe to be at home alone?
I would say safety was going to be the thing that comes to my mind. Are they leaving the burners on? Are they, I think we had a client years ago that was, putting newspapers in the washer. Are they leaving their home in the middle of the night to go searching? So I think safety comes to my mind when you're thinking of like, what does that sign look like?
Other comments?
I
Yeah,
agree
I
with
could.
Jessica. Yeah, the safety aspect. At some point, if it's really unsafe for individuals to be in the home, and especially when, there's the fire danger, all of those things, and we have seen that multiple times through my career there, which is very scary.
Mm-hmm.
Yeah, yeah. Usually it's dementia related, safety related, or mobility related. You're
Yeah.
just a fall risk.
So at what point do most families reach out for help?
When it's too late, not soon enough. Um, I think it's, I think people, they try, and it's human nature. I think you want to try, you want to keep trying, you want to do everything you can for your loved one, or the person you're caring for, and you burn out in the process. And and so I think recognizing those signs sooner rather than later, or getting that education and knowing what it looks like, is important. But I think, it starts with as soon as you're feeling overwhelmed or that it's becoming too much to handle.
Yeah, and I
Other
think it's okay to reach out to us. We're
Yeah.
going to talk to you and give you some information to support you to get what you need. So if you're not already connected with a support group or you don't have people in your life that can assist, we're going to brainstorm and help connect the dots with you and be here to catch it when you're ready to take the next step.
And a lot of us work together,
Yep.
even the home care agencies here all work together. So we're all going to figure out what's going to be the most helpful. Is it if I'm not what you need, maybe Ginger is, maybe Julie is. Maybe I need to send them to Christina or Sarah. So we all work together.
So what's a typical trigger that you get a phone call? What caused that phone call? What made them make that call?
A hospitalization,
Hospital
a lot of
visit.
times.
Mm-hmm.
Yeah. A new fall, hospital visit, a fight.
And I
Yeah,
was going to
finances are one too. If people are seeing like their loved ones aren't paying the electricity, they're not getting their bills paid. They're going to, be like, hey, I'm noticing these things. But I would say falls, hospital visits.
And I was going to say, Lynn, I think some of these things are a lot more obvious to people, like the falls. They're just easier to pinpoint. We've had a fall. Someone's, not eating as much. Bills aren't getting paid. I think what gets harder to recognize, especially for probably a lot of the people that are listening in on this call, is the caregiver burnout. And that tends to be where the too late part comes in because we just think, well, today was a bad day. But the day before was a really good day. So maybe tomorrow's going to be a good day again. And so, what I always suggest to my families when they're on that kind of fence is one, write down what you think your end point is. And for everyone, that's different. Some people are not comfortable providing personal care to other people. And so that might be the line that they draw and say, okay, once they're no longer able to take care of their toileting needs on their own, then I'm not going to do it. Other people, it's like, okay, once if they start waking up at night and I'm not getting a good night's sleep. But oftentimes, too, for our loved ones, we'll keep moving that line down the road and just kind of kicking that can and going, well, I can do this today. I could do it for a week. And then suddenly you realize you're doing it for weeks and months and it's taking its toll on you. So then I say you need to start looking at when you're having more rough days than you are good days. But again, if you call us ahead of time and just walk through some of these things or know what the options are out there, sooner rather than later. And again, maybe it's just bringing in a couple hours of in-home care to help with showers to give you a break so that you can go run errands or go have a cup of coffee with a friend. But I just think that's the hardest thing for people to wrap their head around is there's the guilt of, being burnt out. And so it's just not as cut and dry as some of these other things.
Well, and
And some,
there's guilt, I'm sorry, around I made this commitment to my loved one
Mm-hmm.
and I'm failing if I don't continue this. And so some of it is reframing and having conversations with people about what if you looked at it like this, that you are caring for your person in the best way by getting them the care that they really need, and it's beyond what you're able to do anymore. So now you can be the spouse or the daughter or whatever your relationship is without having that hanging over you that's weighing you down. And sometimes it may just be that kind of a conversation where you just change the perspective where now they can rest a little bit easier in this decision that needs to be made and how to move forward. Good point, Sarah.
So, Julie,
yes.
you had mentioned that you work with the VA. Are you all able to work with the VA, and how does that happen?
Well, there's a couple different ways with the VA. VA has two programs. One is their, oh gosh,
Aid and
home,
attendance.
the aid and attendance, but the other one's the HaHa, which is aid and attendance you apply for directly and get the funds directly for it's almost like a long-term care insurance. And if you were a vet who served during any wartime, it didn't have to be overseas. I believe you qualify, and your surviving spouse can qualify for funds as well. And then there's the community health program where the vet would have a social worker that would reach out to us, and they would have a guaranteed number of hours, like 12 hours or 20 hours a week. And then we would provide the care, and the VA would pay us. So there's two different programs with the VA and getting access to funds.
So I know I have a number of group members who have caregivers through the VA, and there are a number of different organizations. So do they all have contracts with the VA? Is that how that works?
Yes, yeah, I have a contract with the VA,
Okay.
and I think any home care agency can jump through a few hoops and get that too.
Mhm.
Okay. So we have a comment: without oversharing, but trying to stay ahead of a tragic event like a fall or walking out the door or even leaving the water running. I don't want to send my mother away too soon, but I don't want her to be in danger. She is a very safe person, but really struggles even to use a faucet or a phone. I think that that's one of those things that you guys were just talking about.
Yeah,
Mhm.
safety.
It's
Yeah, I think that what can be helpful when you're thinking about the next move is to play the tape out to its full end. What if I do this? Maybe moving her to a facility, play that tape out. I can go visit. I can have a little more free time. I'm going to keep this person at home, play that tape out. This is going to get harder. Um, so I think just kind of thinking ahead is helpful.
I think also too that we all the idea of home can vary. So even though it may not be the home that she's lived in for, all this time, I don't know like in what this, these particular circumstances are, but um a lot of times the socialization that people can have living in a community, even small communities like adult family homes, and being around people that are their age that have had similar interests either in the past or currently, and being surrounded by people can do wonders. So I know, I think the comment was like, don't want to send her away. And I know it feels like that, but that's not always the case. When you find the right fit, she actually may thrive instead of just survive, which I know sounds kind of corny, but it's true. I think we've all seen that, even with in-home care.
Yeah.
I think there's times where people are like, there is no way that my mom's going to tolerate having some stranger in her house, and then all of a sudden they become like best friends and they're looking forward to, when this person comes to visit with them because it's just nice to have an additional person there. So, um,
Yeah.
Families will say, I wish I would have done this sooner,
Mhm.
whether that's
Yeah.
for in-home care or for placement. Once that happens, and then their loved one is living a different life and getting the support they need, you see stabilization, you see them living their best lives that they can, given, what's going on for them. So that's exciting on that hand to see the change in the like Sarah was talking about, socialization and activities and liveliness going on rather than being isolated at home.
Yeah.
So we have a comment that hadn't realized that the resources being discussed would be mainly in Clark County. Are there similar resources in Multnomah County? And I would add, how would you access them?
Christina, your agent's over on
Yeah.
that stuff.
Yeah,
Probably.
so we have an 800 number, so you can call our 800 number and find what city are you looking for that way. But we serve Portland as well. Like Sarah, we'll go to Cowlitz County. There's not too much going on in Skamania, but people call and we help them. So we're maybe it's not for us, but we're connecting with, hey, do you know somebody over here or over there? Sarah and I are both belong to a computer system for tracking things, and there's a nationwide network that way. So I just had a family ask, do I know anybody in Connecticut that can help us? And so I got on there and was able to give some resources for other people that are doing the good work we are and using the system that we are to manage things. So already, okay, good.
The other thing is, can you speak to the area agency on aging and disabilities that there is available in every county in the United States?
Yes, you just did, Lynn. Thank you
I,
so
I,
much.
I sort of
Yeah.
did, yes. I thought
I
maybe
would
that you
add
guys
that
might be able to add to that.
Yeah.
uh,
Our local website is helpingelders.org. Um, and that's our agency on aging website, area agency on aging in Southwest Washington disability.
That's
It's a
ours. Yeah.
AAASWDA.
Yeah. Yeah.
Yeah.
But there is definitely one in Multnomah County, and I would reach out because they are incredibly helpful.
I would also go to retirementconnection.com.
Yeah.
They serve Greater Portland and Vancouver, so they would have Multnomah County specific resources there also.
Yeah.
So, a question, at what stage of dementia do you see spouses reaching out for help?
All stages.
Yeah, all stages.
Yeah.
So, and that's
Everybody's line is different, you know. Everybody can
Mhm.
handle a little different uh behaviors, and you know, some people can manage it and others might need a little bit of help.
and what are the biggest misconceptions that families have about dementia care?
Well, I think for like with Christina and I, and probably in home care too, is that when someone gets a dementia diagnosis, especially if it's, early onset, is that automatically means they need to go to memory care. And we have a lot of options where places are trained specifically in dementia. So that's not an automatic, memory care sentence, so to speak. And so I have had actually many times where I've had a family member call and say, well, my mom has dementia, so I need help finding a memory care. And then when I'm talking to them, they're still able to do most of their activities of daily living on their own, bathing, showering, um, all of those things. And so they wouldn't be appropriate for memory care at that time. So, and that dementia isn't a one size fits all. It comes in all different kinds of forms. It presents differently in every single person. And even, after 20 years, I still hear things or see things that I've never heard before. So,
Yeah, there are plenty of individuals with dementia that are living successfully in assisted living and can continue to do that so long as they're safe. You know, they're not exit seeking or leaving and getting lost and or not wanting to go back, refusing care or being aggressive with other residents. Those, would be indicators that it's time to talk about that next level. But many people will move to assisted living and end their journey in assisted living with dementia. So thank you, Sarah, for that point because it's very customizable.
Mhm.
So, in each of your experience, what do you see as the greatest gaps in services in our community?
not enough caregivers, whether that be for, in-home care or in a community setting, but just not enough caregivers to help support the need that's out there.
I also think that seniors, when we age, it's harder to communicate with technology, et cetera. So I think somehow closing the gap between the doctor's offices and seniors, being able to get set up with an appointment easily, because you know they want to be able to call and make an appointment with the phone, but now everything's an app. So I think that's a gap right now. That technology gap um, is hurting seniors currently.
Right, Julie,
There's
we have recently have been talking to caregivers that work for other agencies, and um, clients not being able to get a hold of the agency because they've gone, AI based, all technology. And in an emergency situation, that is a gap. That's not good.
No,
No.
no,
But
I
I
agree.
do, the whole caregiver shortage has been a thing since, at least since COVID.
Yeah,
And we have a lot more agencies in Clark County than we did prior to COVID, which is great. But caregiver shortage is a big thing, and we're finally starting to see an upswing. I don't know if all the other agencies are, but it's going to take us a while to get back to, how many caregivers we had prior to COVID. So.
So if I were
yeah,
to call today and say I need a caregiver in my home tomorrow, is that possible?
Yeah.
yeah.
Yeah, probably with Jessica, right?
Mhm.
Because we have the Medicaid contract, we have referrals from, home and community all the time. We can't turn away a referral. And we do have a wait list for care right now. So if you can private pay, we recommend all your agencies. So if someone can, private pay for a while, that's what we would recommend to be able to get care right away. And it's sad. I would love to say we can start care the next day, and it's just not for CDM. It's not possible at this point.
And like I touched on a little bit earlier, we all work together. So,
Mhm.
if we have somebody that calls and says, I need 24/7 care, and I know I can do the overnights, but the day shifts might be hard, I may reach out to Julie and say, hey, Julie, we've got this situation. What can you guys do? And we have collaborated and worked together to get coverage for these folks.
Yeah. Yeah, we do collaborate a lot. It's nice to know. It's like, well, we can help this person with the assist of another agency.
Mhm.
And then we know they're getting care. It's getting good, they're getting good care. Um, and so yeah, I like working with everybody. And if I meet with a family that I think probably would be better suited for placement to an adult family home or assisted living, I'm going to reach out to Christina or Sarah and say, "Hey, I met with these folks, and I think that they would benefit from meeting with you." Um, just because of it, and it can be for all different kinds of reasons. Because it is complex, as Lynn was speaking to. Not everybody's care is the same, and needs are different, and financial situations are different. So we have to take all of that into account when
Can you
looking at it.
can you guys give us ballpark cost?
For caregiving, we're at 44 an hour right now, starting.
And your minimum, Julie, is 4 hours, correct?
Yeah,
Yep.
yeah.
We are at 39 an hour during the weekdays, but 45 on the weekends. And we have a 4-hour shift minimum.
And if you wanted somebody overnight,
45 for us.
It would probably depend on if it was hospice care or not, but it would be 40, probably 46 to 48.
okay.
And for us, for CDM, for our private pay clients, we have a 2 hour minimum, and it's 45. I think 45.24 an hour.
And how are caregivers vetted? Are they licensed and bonded?
Yes.
And insured, I hope. Licensed, bonded, insured. We do background checks, fingerprinting background checks. We do them biannually as well. We're also looking at their credentials. Do they have a home care aide, a CNA? And then we're doing P&W aging. We do trainings constantly. So we have an on-site person that does hands-on training. Sometimes skills get a little bit rusty, so they might want a little bit more skill training, or we notice that they transferred somebody, not technically right. So maybe we do a training there. Then we have quarterly trainings as well with our staff. So we're always trying to do the best and look out and do the most amazing things for these people because they deserve it. And then we also make sure that, they're supported because caregiver burnout is huge. And so I think the support for our staff is important, just as important as vetting new caregivers as well.
Thank you. So,
Oh, Lynn, sorry. Can I
sorry,
speak for a minute? I'm sorry.
please do.
For CDM, we actually can put people through home care aid training. We have a partnership with SEIU, and we are able to put them through home care aid training if they're not currently certified, and they do not have to pay for that. Um, and then their continuing education. Plus, we have a staff member who does the on-spot training, just like Jessica's. If someone has worked, for 20 years and hasn't done maybe a bed bath. We have someone from that's trained to be able to go out and do that on the spot training in the moment.
Yeah,
So the
same.
people that go into the home, are they able to administer medication?
Not for our
Mm,
agency. We can do medication reminders, and we can do delegations. So that would be if under a nurse, they would be delegated to do a certain task, like an eye drop, an ear drop, things like that.
Okay.
Same for CDM.
Yep.
Okay. So once we have a caregiver in the home, what are the earliest signs or indicators that the family is needing additional support that they are not currently getting? And what does the caregiver do about that?
Can you repeat that question, Lynn?
Say we already have a caregiver in the home,
Mm-hmm.
but there are some signs, perhaps, that additional support may be necessary. And what are those typically? And are the caregivers obligated to indicate that there's something more going on?
Oh yeah. Yeah, if they see a decline in a client's condition or a change in their condition, they're required to call and let us know. So we can talk to the family and say that we've got some concerns. This is what's happening, or this is what we've noticed. Um, or get folks to make the appropriate doctor's appointments to get them checked out. Um, and and then yeah, maybe adding a few more hours, which might mean another caregiver as well.
Mhm.
So, are there specific situations that make it difficult for someone with dementia to stay at home?
I think the safety concern comes back into play here. Um, if there's a lot of safety issues arising, again, leaving burners on, leaving the home, you know, in the middle of the night, I think, that would be a reason that they may need to look at that. Or maybe the person caring for them, maybe it's the husband caring for the wife and he's burnt out. He can't stay up all night anymore. He's exhausted. And he's falling to sleep during the day and she's escaping out the front door. Or she's caught, put the towel on the burner and it's caught fire. Like there's so many things that, they should be looking at.
Yeah, I find that if there's the person, if there's a caregiver in the home with the person with dementia, they're going to be able to tell you if there's a pattern.
Mm-hmm.
If does she get up and try and turn on the burner every morning? They'll often say, "Well, she quit cooking." Oh well, we don't need to worry about the burners because she quit cooking, but she probably quit cooking because of the dementia. Um, but so yeah, knowing that the pattern, the daily pattern, to kind of address or identify any safety concerns. But sometimes they go about their day as if they had the last 20 years, um, because it's a pattern and it's not a dangerous one, and they might be
Mm-hmm.
safe at home. But that can change with a an injury or something else as well, or a cognitive decline where you're noticing
Yeah.
behaviors that are unsafe.
Is there specialized dementia training for caregivers?
Yes.
Yes.
Yeah, to get your license, you need to go through dementia training. We require dementia training as well. And then usually the continuing education will have reminders and refreshers on dementia training. And then we also are always available for caregivers if they're struggling, because sometimes it'll be hard to, a client will be difficult to shower and they need help. They just need support, ideas on how to maybe get that to happen. So yeah.
Yeah, and I would say, at PNW, we also do, we're dementia friends. So we've set our caregivers into the dementia experiences, where they get to experience what it's like to live with dementia. And we've done a few courses on it in the office as well. How to set a plate setting when you've got people talking around you and there's a lot going on and the distraction that you feel. And so there's always the continuing education pieces, but also being the support, like Julie said, and making sure that they're getting those continuing education pieces, but also feeling the support from the office staff.
And how do you provide support for the care partner as well as the person who has dementia? Or do
Oh,
you?
we answer the phone 24/7.
Mm-hmm.
So if you need support, and we listen, if the family's got questions or concerns, we're going to meet the challenge and see if we can come up with an idea or a modification to help support them.
Mm-hmm.
What do you hear from families about what they wish they had known sooner?
I think that the resources are out there, and what the first steps are.
I think also that a lot of people, while they're might not be on the exact same journey that they're on, that things are different, but that a lot of people are on that same pathway and they've had to also make these hard decisions too. And so they're not alone. And I think the biggest thing is they're not failing, that they're not failing the person if they're getting help, whether that be bringing in help at home or, having to move them. That is not a fail. That's actually sometimes the best thing that you can do for the person. Um, so.
So, for the home care agencies, is that a discussion that you ever have with the family that that they are not in a safe situation and it's time to consider something else?
Oh yeah.
We,
Yeah.
yeah, we definitely do. We also work with, the state case managers when, the change of condition happens and, what are those next steps? Do we need more, authorized hours to take care of that loved one? But, then what are those next steps if they're not safe anymore in their home?
Yes, we've had to intervene. Oftentimes it's when the person can't bear weight any longer, um, and the family still wants us to move or try to transfer someone, and there we're at a crossroads. Then we need to either bring in equipment that can help the caregiver to lift the person, or we're talking about getting a higher level of care at an adult family home or assisted living. So yeah, we have those conversations. If a caregiver's safety is at risk, transferring, we got to
Mm-hmm.
talk.
And so
Yeah.
you will make notification if it's no longer safe for your caregiver to be in the situation.
Yes.
Yeah. I mean, I had a potential client call today. Her husband had had a fall, which we were talking to her prior to the fall, about getting some help in the home for her because she was tired. So that was a kudos to her because she was trying to plan ahead. And then he had a fall, and she's like, the hospital's telling me this is not safe to go home. And she's like, realistically, what do you think? And I was like, well, like, can he do this? Can this be provided? Is he safe in this situation? The answers were all no. And so it was, it would not have been right of me to say, you need 24/7 care. We're not the right placement at this time. So allowing her to go to the placements. And I had referred them to these two lovely ladies up here on the top of my screen to seek additional help so that we can get him in the right place that he needs to be.
Well, that was a perfect segue because now I have some questions specifically for our placement ladies. And the first one is, when should families begin thinking about assisted living or memory care?
Today.
If
Call
you're
us.
asking yourself that question, you're already thinking about it, which would be time to just call and have a conversation with us to start with. But it doesn't mean you're, making that decision right now.
And it's okay not to know what you don't know. A lot of times families will say, I don't know anything. I'm like, that's okay. And why would you? Nobody took a class on this stuff. We're in it because we've been doing it for a long time. And so we're happy to help share information with you about what we know.
What are the biggest mistakes that families make when choosing an alternative living situation?
I think that can vary a little bit, but often what I see is financial. So I'll get a call, someone already, they on their own went and picked a place. And then they'll find out later that it doesn't have a Medicaid contract. And so they are being told you can't stay here. And they were under the assumption that, I thought Medicaid just kind of starts picking up the tab when I run out of money. And that's not, how it works. And that's a conversation that Christine and I have with families when they call too, kind of what that financial um, picture looks like. And then it's all of it is kind of it's like a puzzle piece, and we're trying to match all those pieces together as much as possible. Um, so we're asking questions about, finances and budget, care needs, obviously, but then also the good things too. Do they have a little dog they're wanting to bring with them? And are they a social person? Are they someone who really just like to just sit and watch, TV and read their book every day? And so trying to make the best match that fits all those puzzle pieces.
How do families determine when is the right time? Do you help them with that?
Well, I think when we're talking, right, Sarah, we're helping them discover it for themselves. Like she said, if you're asking about it now, it's probably the right time, but call us and let us talk with you about it, so we can help you make the best decision based on what's going on for you and your loved one.
Yeah, I think we've both had families that we've talked to and that we talk to off and on and check in with them, over the course of multiple years. I think the longest one I ever had was about 3 years, and before she ended up moving, and that's okay. I have people that I worked with that saw this call last year and had hoped to go a lot longer, but months later had to make the move. So again, without, none of us have that crystal ball. And for a lot of people, we're just one incident, whether that be a fall or a wandering around the neighborhood or getting lost somewhere away from, needing to make that move. And so if you can just arm yourself with the information ahead of time, it's always going to be stressful. It just is. It's a stressful thing to go through, but you will feel less stressed about it with the more information that you have ahead of time.
And it's free to call us. So just call.
Yeah.
We'll be nice. It'll be okay.
So, is there a standard list of questions that people should have in their mind when they're touring either an adult family home or an assisted living, and then specifically memory care?
Of course, there are lists. When Sarah and we work very similarly, that we're going with families whenever possible, that we are with our families and we're touring. And so when I'm with a family, I'm telling them, let's just go and I will help ask questions on your behalf if things aren't, coming up. So we know things. But really it's about trusting your gut. I feel like you can have all the spreadsheets of the world for all the spreadsheet people out there. It's fine, black and white. But when everything is said and done, how did you feel when you walked in? Is adult family home, did that provider, is that somebody who could be a care partner for your person and for you as the family? Can you communicate with that person? I mean, there's some high level things that I might suggest or we talk through, or I prep them before we get there. Like, I want you to be feeling it when you walked out. Do you feel like your person would be safe here when you go home, that you could sleep at night? If you didn't get those vibes, then this is not the place. Now, Sarah and I have been doing this a long time, so it's unusual, I believe, that when we show options that none of those are fits, because we've listened really carefully and we have done a great job of matching up what you've asked for, but didn't know that you were asking for. But because we know things, we're putting it together for you.
How do you
Yeah.
balance safety with maintaining quality of life and independence? And I guess I would ask that of all of you because we've all spent our lives being independent, and
Mhm.
suddenly that shifts a little bit.
Yeah. I think shifting the idea of what independence means can help. Um, uh, is it, are you independent because you called and asked for help? I think so. That's showing independence. Um, so I think that, I guess the question would be, what is it that you fear you're losing? You know, what is it that you fear you're losing? Is it your independence? Is it your privacy? Is it the control? Really identifying what the fear is, um, and that I think can help you move forward with that.
And I think independence and quality of life can go hand in hand because if I think like bathing is a great example. If someone's not showering any longer because they're worried that they're gonna fall, then they're losing quality of life. So they may feel like they're keeping their independence by not having somebody come in and help them, take a shower. But at the same token, they're giving up quality of life. Now you have to worry about, other issues, UTIs and wounds and sores and all that kinds of stuff. So where sometimes I think people are trying to protect themselves and keep that independence, it can have the opposite effect. And
Yeah, yeah.
So
Asking for help is an independent action.
here's a question that says, how about the questions to consider when you're choosing a home care agency? Are questions similar? Do the home care agencies anticipate specific questions that people should be asking, or that you actually magically provide the answers to certain questions?
Well, I think if you're choosing an agency or choosing a community or choosing a partner in any of this, can you get a hold of them? Um, can you stop by at any time of the day and they're not going to be mad at you? Um, I think those are really important. I think local ownership is a key piece too. I think if you live in the community that you're providing care for, people you'll be faced with the members of your community, and so you've got to be good at what you do. And if you're not local, it's easy to not see the people as humans and such, as what I've kind of experienced. Um,
Or you
so
don't
I
have a
hope
good
that,
grasp of all the options, right? So we know what the options are here. If you are
yeah,
coming from another area, and you don't, so you're not getting the full scope of what your possibilities could be for placement. That kind of,
right.
yeah.
And I think, also when they're looking at home care and thinking of the right fit, I mean, home cares, a lot of us do the same thing. And so I think having the local, so we're involved in the community, we are interacting with people out in the community is important. But I always find that they don't always know what they're looking for when they call. So sometimes, if they're like, hey, my loved one needs help with bathing, they might not understand like all the steps, like, well, what do they need help with? Like what part of that step do they need help with? And then they might realize, oh, well, yeah, I think getting, dressed might also be helpful. And so I think sitting, being a good listener, an active listener, and getting to the bottom of exactly what they need. And I have nothing against the facilities, I really don't. But I think that, when you're in home and you can customize those care plans, we don't charge extra for those little things. So I always point out to people, if they need help with dressing and bathing and personal care, there's not additional cost for that. The cost is our 39 for weekdays and 45 for weekends. So let's get you the best care you can possibly get for what you're paying for.
And I think
So,
the thing that Christina brought up too is a lot of it's going to be your comfort level and how you drive with the people,
Mhm.
your caregiver, the office staff that you're calling. Like these are the people become part of your care team. And so are you able to communicate with them well? Do you feel like they're listening to your wants and your needs? And um, you know when you mesh well with someone and when you don't.
Right. And when they are calling Sarah and I'm confident that Sarah does this as well. We're coaching families. When you call these agencies, you'll be better served if you can think about what is it that you really want and how many hours do you think that is and how many days. So the more you can share up front, they can tell you right out of the gate, yes, we think that we can fill that order, if you will, and talk through it. So we're coaching families so that they can have a better experience in own home care because they don't know what they don't know. So we're just trying to
Yeah.
help them
Mm.
identify that ahead of time.
And I find people will come and they think they just need 4 hours, but when you talk to them, really they need 3 days a week would be really beneficial because then at least they're getting medications 3 days out of the 7.
Mhm.
But and you're going to be able to see if they took it the day before or not, and that you can make sure that they've got meals and fresh fruits and vegetables ready and prepared. Um, Whereas one day you might just have enough time for a shower, get ready, and maybe a trip to the doctor. Uh, and that's usually if you need that kind of help, you probably need a little bit more. So educating people on the benefits of having the support maybe a few days a week versus just one.
we
Um,
just
Jessica, I know you guys you're a little bit in unique that you have care managers too. Is there times where it's like a better role for a care manager versus a caregiver, or is there?
Yeah, no, there's definitely times where a care manager, because the care manager is bill in 15-minute increments, whereas a caregiver, you've got the 4-hour shift minimum. And maybe, they just need help calling the doctor, or maybe they just need help scheduling that doctor's appointment. So having a caregiver do that and there's a 4-hour shift minimum, that's not going to help them. Where the case management care managers, they can call and make the 15-minute increment phone call for them and handle those matters. Or maybe there's just a quick trip to the doctors and they don't need 4 hours. Or maybe they just need help, booking airline tickets. Maybe they're going to go on a fun cruise, but they want to make sure that they're going to do that safely. So, yeah, so we do offer the care management in lieu of caregiving so that we can kind of customize that care to them.
so for the home care agencies, do you all provide transportation to the doctor, et cetera?
Yes.
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 Okay. And we have a question that I I'm not sure if it kind of stopped. Tony says that he has a son who is a CNA, and can I have him? Sorry, Tony, my that's all that I can see. Can you clarify that question for us?
He can apply at Home Instead and PNW and CDM.
Yeah.
Yes.
Here we are.
Get him.
He's a CNA
Oh, at home.
working
Okay.
in a care facility. Can I get him? Um, does that differ from a caregiver need for help? Long-term care companies seem to have strict criteria for when in-home or facility care is needed, and that may differ.
I know that there is a way to have to be like a paid family caregiver, but usually there's income restrictions
Mhm.
on that. I don't know if the home care people can speak more to that.
Yeah, if they are eligible for any kind of Medicaid program or respite program, they could, um, they could, a caregiver can go through CDWA and apply, and then they can be then staffed with their loved one.
And if they want to know more about that, they can go online and look up COPE's caregiving.
Yeah, or CDWA is, if they're looking at that, that's probably the best source. And also if a client has a state case manager, they can assist with that.
That's good to know. Good to know.
Mhm.
But I do believe, and maybe home care can, I do believe that the long-term care insurance companies do have strict rules and it can't be a family member.
Mhm.
You have to go through an agency, I believe.
Yeah.
Typically, that
So,
is the case.
related to collaboration, what would make referrals between healthcare providers, home care placement specialists, and organizations like Hope, for example, easier?
I hear that Vancouver's pretty special in terms of what we have, this collaboration that we are doing, that it
Hmm.
doesn't exist in other places like we do. So I'm not really sure what would make that better. I mean, like, you pick up the phone, we call each other.
Yeah.
Mhm.
Yeah, only if we all used one system to communicate all of our notes.
That would be good.
Uh,
Yeah.
So, what information would be most helpful to receive when a family is referred to you? And where do the families tend to fall through the cracks?
Mm.
Well, for placement, it's always helpful if you're making referral to us, asking the family, is it all right if Christina or Sarah calls you directly? That's one less thing that is on their list of things that they need to do or want to do that we can call. And I think in-home care will do the same. So that's
Yeah.
helpful. And sometimes families are not comfortable with that. They want to make that call. And so we're holding that spot, kind of like watching for them to call, so that we can help them. And then letting our referral partners know, I didn't hear from her. So then they can maybe, poke in and what's happening. Or I did hear from her and here's what's happening. And thank you so much. Because now they're in a better situation.
Yeah. I think the communication is so important. Because, if I have a client that I've been working with a long time and they're special to me and my caregivers love them, and we know that it's probably time for them to be making a move, I want someone that I know is going to do a good job. And
Mhm.
that's why, and so when I talk with or vet someone that I'm going to refer to, I want to know what their motivation is. Um, are they motivated only by hitting their quotas? Or are they motivated by getting the person placed and cared for? And we're lucky we've got these folks here that we all know that they care about the senior and they're going to do what's right for the senior, even if that means they make less money. Um, it just and those are the kind of folks I'm looking for to work with, you know, and we've got a good group.
Great.
You do bring up a good point. However, in Vancouver, there are quite a large number of placement agencies. And of course, as an organization, Hope as an organization, we don't typically make specific referrals other than to say that this has been our experience.
Mm-hmm.
And that's more from a human being standpoint. My experience is this. And because we are committed to the people that we work with, we want to We want to know what we're talking about. But I
Mhm.
think it's only fair to say that there are a large number of placement agencies in Clark County.
Yeah.
I don't know if that's an unusually large number because I really don't know about any place else, but
No, actually, I think per capita we actually have less than Portland
do
does,
we?
but
Oh.
um, but
So
I
you're saying we should have more?
no, I know.
Mhm.
But I think when you're vetting for, a placement agent, number one, I would want to know that they're touring with families, that they're not just an online, here's your list. You go explore the options and get back to me which one you liked because it's important that we are in the communities, we're watching what's happening, we're looking at the residents, we're seeing staff turnover, we're seeing management turnover. And you don't know that those things are happening if you're not actually in these facilities,
Yeah.
looking at that.
That's a great point
Mhm.
Mhm.
because there are big companies that collect web leads in order to sell them to companies like ours. And they have different names. They might be like a place for mom is one, but a place for mom has 1,500 different websites that all go back to their central website. So it could be memory care related. It could be um, fall related. It could be all kinds of things that will feed into a place for mom, which is not local, and they're not boots on the ground. They don't go into the facilities like Christina and Sarah do. And so I think knowing that there are these big conglomerates out there that you can go search for stuff on Google, but these big guys are looking for you and they're grabbing them up.
Yeah.
So
They're not going to know the
local,
behind the scenes like we do
no,
and tell you what the
no,
truth of it is. And we will tell you the truth. If you ask me about a particular community and I am going to tell you I'm not on board with that and here's why. Or I've checked the state records and there is a naughty list this long of missteps and lack of care. And so I cannot recommend that for this situation. So we're watching those things too and telling people what we find. So trust your gut. So, yep, there's a whole lot of options for placement in Clark County. Call people, talk to them, see how it
mhm,
feels,
yeah.
right? I mean,
So a little bit about finance, because I know a number of people that are hanging on by their fingernails, but they're doing it because they think that they're going to run out of money. And it's not just running out of money for caring for their loved one, it is having money left to care for themselves. So these are a couple of questions. What financial barriers prevent people from getting the care that they need?
It's
that would be it,
expensive.
right? They can't, don't
Expensive.
have the
Yeah.
Yeah.
funds. Yeah.
Yeah. Or they're kind of in that gap where they don't really make a lot of money, but they don't make uh, so little that they can access benefits. Um, that's a
And then they're
tough
looking
one.
at spend downs.
Yeah.
Yeah, and that's where sometimes in-home care is the answer. A couple hours of in-home care a week, might be what somebody needs, versus moving, because maybe all they need is help with showers and, some meal prep and things like that, and that's enough. At the same token, also not doing in-home care so long where you're exhausting all your financial resources doing that and spending all your assets on that. So then by the time you get to the point where you need placement, you don't have enough to do a spend down. And I know that's a whole nother topic, and usually Hope does a presentation on that, every year too. But Christina and I can talk to you more in depth about what that looks like. But um, we have options out there where they're what we call fast spend downs. So they might be like less than a year, but the more when you're closer to 2 or 3 years, it just means you're going to have more options on where you can move. So paying attention to that, like in-home care might be great for right now, but once you're spending really dipping into those assets a lot, you might want to look at whether that should be the long term plan.
Somebody just asked a great question. He says, what is spin down?
Yeah, so I don't know if anybody else wants to take
Okay.
this. Or
So there are communities, assisted living communities that have a contract with Medicaid. And each of those communities and adult family homes, they get to decide what their contract um, terms are. So you might have an assisted living that requires a 3-year spend down, meaning every month that you pay goes towards that benefit of having a Medicaid situation come together. So I'm paying every month for 3 years. And when I get to that third, that 36th month, that's right, 12 times three, then I've met the criteria that this community requires for Medicaid. And if I've also run out of funds and I'm eligible for Medicaid, then I can stay there and Medicaid will pay for me to be there. I will give up the majority of my Social Security to the community. That's my portion that I'm paying, but Medicaid is filling in the rest. And that is scenario is how that would work for a 1-year spend down or a 2-year spend down. Sarah was talking about if somebody is doesn't have those full amounts to be able to pay what's set in a community, then we find that there's more flexibility in an adult family home where because of our relationship, I might say, hey, I've got this situation and this family has 3 months of money before they're going to need Medicaid. Can you help us? Nope. Next. Hey, so we're calling our resources and asking for help on that to get people what they need. Does that helpful?
Yes, absolutely.
And
And
just
what is a typical spin down? Is there a typical spin down? And what is it?
I would say 2
2
years,
years is probably
but there's a lot of, especially the bigger communities out there that do not have Medicaid contracts at
at
all.
all. Right.
That's another reason to go through a referral agent so that you don't find yourself in a predicament where that either isn't discussed when you toured the community, or sometimes there's a lot of information being thrown at you. It might be mentioned casually. So
Right.
something that we help walk you through.
And then you find that
Absolutely.
you're having to move from the facility that you thought you were going to be staying at. So
Mhm. Yep, Sarah and I've received those calls. It's like we were here and now we're out of money and we have to go. It's like, I didn't anybody what we have no idea how that occurred, but here we are today now. How do we help you? But when we're talking with people initially, we're having those conversations up front, which for some people can be uncomfortable. It's like, no, I don't want to know what the number is, your pot of money. Like, let's just do a math problem. If it costs this, how long can you before you're concerned about it? Just as a high level so that we can like have those, and then we can start talking a little bit deeper about what Medicaid spend down looks like or narrowing it down like, okay, so you're going to need Medicaid. That means these options are not for you. So let's not waste your effort or your time or those communities' time by talking to them because it's not going to be helpful.
Well, I have about a million more questions, but our time is just about up. So what I'm
Mhm.
going to ask is, what is it that each one of you would like the people on this call to know?
you've got a team of people that are willing to help you, even if you've just got questions.
Yeah. Answers are free.
Mm-hmm.
When we all work together, we all communicate with each other, and all of us are a phone call away for, even after this call, reach out to one of us. We will be able to help you. And if one of us can't, we would refer you to someone else on the panel.
Mm-hmm.
Mhm.
I joke around and I say, hey, I come in peace, but I mean business.
Mhm.
And I think that all of us meet that criteria. We are coming in peace, but we mean business and we want to help you get what you need, where we'll tell you our truth of that.
Yeah.
And don't wait, just pick up the phone and have the conversation. That's the first step.
Yeah.
Well, we
And
are,
go
go
ahead.
ahead, Julie.
Oh, I was just going to say, if you're 40 and your parents are 70, it's time to have that conversation.
Thank you, ladies, so much. I can't tell you how I value you all. And one of the questions is, can we get contact information, I definitely will send that out. This is recorded. It will be on our YouTube channel, and I will send out the link when it's ready, which is usually in a couple of days, and I'll send the
Okay.
contact information out at that time as well. So thank you to our panelists. This was wonderful. As
Thank you.
always, and hopefully we'll see you again next year.
Yeah,
Sounds good.
It might be a better climate, perhaps.
maybe. All
Yeah.
right. We'll
Thank
see ya.
y'all.
Bye. Thank you.
Bye.
You.
Bye.